government of St. Lucia requested grant funding support from the government of Mexico in the amount of $2.65 million towards the completion of infrastructure components of the St. Jude's Hospital Reconstruction project. This request was approved recently, and the funding is being provided through the Infrastructure Trust Fund for Mesoamerican and Caribbean countries, which we call the Yucatan Agreement. And these funds will be used for 3 subcomponents of the project. These components will be identified from the various speakers that we have here today on the program. On behalf of the Department of Planning and National Development, it is my pleasure to welcome you to the presentation ceremony to hand over the signed donation contract between the Government of St. Lucia, the Government of Mexico, and the United Nations Office Project Services, as well as the handover of the signed memorandum of agreement between UNOPS and the Government of St. Lucia for the implementation of this project. As I said before, more information will be provided by the speakers on the agenda today. At this time, I'd like to welcome Ms. Corinth Thomas, Permanent Secretary in the Ministry of Health, to provide the welcome remarks to the ceremony.
I bring warm greetings from the Minister of Health, Wellness, Human Services and Gender Relations, Honorable Alvina Reynolds. On behalf of the Ministry and on my own behalf, bienvenido a todo. It is a great pleasure to welcome you all to the Government of St. Lucia and Government of Mexico Cooperation Project for the reconstruction of the St. Jude Hospital presentation ceremony. Ladies and gentlemen, our healthcare system is evolving. While underlying these changes are declining birth rates, over time, our healthcare system has achieved good outcomes for St. Lucians, and as a population, we have realized some significant gains with the support and assistance of numerous local, regional, and international partners. Permit me a few minutes to present a few of these gains. High rates of immunization coverage. We are registering a 99% coverage for immunizations. Decreases in incidence of communicable diseases such as AIDS, improvements in nutritional status of children, expansion of health and social services, improvements in physical infrastructure through significant investments in hospitals. Health facilities on the island are situated within a 3-mile radius of where people work and live. Strengthening and expanding of health programs in maternal and child health, men's health, adolescent health, mental health. Expansion of a health management information system in wellness centers and soon to be expanded to hospitals. Commencement of a health sector legislation review. On completion, will be informed by a comprehensive health sector policy, including a health financing policy, a human resource for health policy, a revised governance model for the health sector, and a national quality management framework. The Government of St. Lucia continues to invest in the health sector with investments in preventive and more recently, tremendous attention to public health in preventing newly emerging diseases from reaching our shores, such as chikungunya, Ebola, and more recently, we have our watchful eye on the Zika virus and the MERS coronavirus. And primary care sectors with the extension of hours of service and integration of health services to better manage CNCDs. All will agree, though, that ultimately what people really want is good health and good quality of life. As individuals, we would like to stay healthy and delay any hospitalization and institutionalized care for as long as possible. If, however, we do need to be hospitalized, staying in a well-equipped hospital with skillful doctors, caring nurses, and other healthcare personnel is a minimum first step in the curing and rehabilitative process. Ultimately, our goal is to go home healthy. Now, this grant contribution from the Infrastructure Fund Trust for Mesoamerica and the Caribbean, made possible by the government of Mexico, towards the completion of the reconstruction of 3 project subcomponents of the St. Jude Hospital, takes us one step closer to realizing this goal in the south of the island. The resources from this grant will allow the St. Jude Hospital to continue on a journey of innovation, and you will hear quite a bit about the renewable energy solutions that are part and parcel of these subcomponents. It will also allow for improvements and full functionality of the hospital. I therefore wish to welcome to the health sector family in St. Lucia and to express a deep sense of appreciation to His Excellency Luis Lopez Moreno, Ambassador of Mexico and the OECS, and the government and people of Mexico for the funding, and to the United Nations Office for Project Services for facilitating the project subcomponents. I want to take this opportunity to recognize the work of the St. Jude Hospital Reconstruction Project team, led by Ms. King, and for great input from Mr. Singh and his team as well, for all the work that has been done to date. To the staff of St. Jude and the residents of the South, I seek your patience for some more time. World-class healthcare is definitely on the horizon with this generous gift. I bid you welcome to all. Thank you.
Allow me to convey to you the compliments of President Enrique Peña Nieto and the Minister of Foreign Affairs, José Antonio Meade, along with the profound message of personal fortune, prosperity, and well-being to the people of St. Lucia. Honorable Prime Minister, one of the strategic points of the government of President Enrique Peña Nieto is to have a Mexican nation as a responsible global actor. The government wants to consolidate the country as a state which respects and defends the international law, a country that promotes free trade, guarantees the investment that it receives, and is a supportive and responsible nation that champions peace and solidarity between countries. Mexico also wants to strengthen its international presence and enhance, in particular, its international cooperation for the development of the Caribbean countries. For this reason, it is very important for me and the Embassy of Mexico representative, for Mr. Salgado and Ms. Narvaez, part of the team of the Mexican Embassy, to address to you today during this presentation ceremony of the St. Jude Hospital Reconstruction Project contracts. These represent the achievement of 2 countries, Your Excellency, when they work together as partners towards a common goal. And we are very happy for that, believe me. As I mentioned before, for my country, the implementation of an effective international cooperation is a key aspect of our foreign policy, and we work to achieve sustainable human development through our region. The Infrastructure Fund for Mesoamerican and Caribbean countries that mentioned in the PS, as part of the Yucatan Agreement, is the tool that allows us to reach this goal, funding projects such as this one for $2.7 million. We believe that this is a very important contribution for St. Lucia. And it's the second for St. Lucia and the second for the Eastern Caribbean states region. That is very important for us too. Last year, Minister Meade visited St. Lucia, as you remember, Your Excellency, and pledged Mexico's support to this country. And today, we are again honoring his promise with this second project. The donation of St. Jude project is a strong example of Mexico's commitment toward the Caribbean, our third border, a sub-region where we don't only have friends, but also allies, as well as shared development objectives and opportunities. Everyone should have access to healthcare facilities, and for us, it's an honor to support St. Lucia efforts to provide such access to these people, generating a lasting positive impact in their quality of life that mentioned the PS before. Mexico, through the Mexican Agency for International Cooperation, MEXID, is willing to offer high-impact regional cooperation program in sectors such as health, environment, education, infrastructure, science, and technology in order to continue complementing projects that create tangible benefits. This effort will be extremely difficult to reach without the participation of the UNOPS, which help us guaranteeing a satisfactory outcome. We would also like to express our gratitude to the various government officials like Chanta Kim, for example, that working to achieve the goals, and the staff of the Ministry of External Affairs that work with us together. Let me also recognize the Honorable Prime Minister Alba Baptiste, who, whenever attended any international meeting and met with Mexican officials, emphasized the importance and benefits of such projects to St. Lucia. Finally, as we continue making this transformation, Mexico and St. Lucia will be heading to a new era of bilateral commitment with real benefits resulting from joint collaboration, determination, and strengthening of the ties among our countries and within the region. I thank you.
I'm really very pleased to welcome you to this presentation ceremony, which signifies the Government of Mexico's contribution to the Government of St. Lucia to facilitate completion of the new St. Jude Hospital facility. Undoubtedly, the people of the South stretching from Micoud North to Soufrière have been extremely patient as they await the completion of this new health facility. I thank in particular the people of the Vieux-Fort community in whose constituency the hospital is located. They, more than any other, have had to suffer the brunt of the consequences in the delay of the completion of the hospital. My overriding concern has always been that the people of the South are not shortchanged and given a second-class facility once again. Construction of the new hospital commenced in 2010, following the fire to the surgical building in 2009. However, this project has had its fair share of difficulties, including unanticipated removal of asbestos at the old hospital site. Unfortunately, the old military-style constructed walls proved quite a challenge to demolish. In the process, and rather unfortunately, there was some significant damage to equipment. Of course, these difficulties have led to unplanned costs with the associated challenge of securing finances to complete the facility. I am pleased, therefore, to note that to date, the Government of St. Lucia has secured the financing required for completion of the hospital through generous support from the local community, the St. Lucia diaspora, friendly governments, and international organizations. The Government of St. Lucia registers our gratitude for this support, whether they have been small or large contributions of finance, equipment, or services. I also thank the people of the South for their patience as we continue towards completion of the physical infrastructure of the hospital. Once completed, the St. Jude Hospital will be a modern state-of-the-art healthcare facility. It will offer a wide range of inpatient, outpatient, ancillary, and outreach services. The reputation of the St. Jude Hospital precedes it, and therefore we know that the people of the South will receive excellent healthcare and advisory services within the comfort of a modern, well-equipped facility. Today, the Government of St. Lucia receives a signed donation contract for the amount of US $2,657,890.50 towards meeting the cost of completing the hospital. This grant is made by the Government of Mexico through the operations of the Infrastructure Fund for Mesoamerica and Caribbean countries. This is a relatively new facility which since established has made two awards to the Government of St. Lucia. We recognize this as a strong commitment to the development of St. Lucia and express our sincere thanks to the government and people of Mexico. I ask His Excellency, Ambassador Luis Manuel Lopez Moreno, to convey my appreciation to President Enrique Peña Nieto of Mexico, who has been working on deepening the bonds of friendship between the Caribbean community and Mexico. Mexico has proved to be a sincere, reliable, and trusted neighbor. I will, of course, have the opportunity at the EU-CELAC Summit in Brussels later this week to express my personal thanks and gratitude to President Peña Nieto. This grant that we bear witness today will be utilized specifically for the following project subcomponents: construction of the morgue building with associated renewable energy solutions, construction of the security monitoring and ambulance building with associated renewable energy solutions, and supply and installation of the external area lighting of the hospital with associated renewable energy solutions. The implementation of these project subcomponents will be facilitated by the United Nations Office for Project Services, UNOPS. UNOPS has worked very closely with the government of St. Lucia in presentation of relevant technical documentation to support the grant application process. As project manager, UNOPS will have responsibility for the procurement, contract management, and monitoring of the implementation process for these subcomponents. UNOPS will also continue to act as an intermediary on behalf of the government of St. Lucia and its people regarding this and other grant facilities to be extended by the Infrastructure Fund for Mesoamerica and Caribbean countries. UNOPS also has responsibility for the implementation of the Dennery Water Supply Redevelopment Project, another project which is funded through the generous assistance of the government of Mexico. UNOPS has undoubtedly become a trusted advisor and partner. I take this opportunity to thank UNOPS for their services, in particular Mr. Mazin, who has provided us with credible technical advice throughout this process. By now, Mr. Mazin and his team should be settled in St. Lucia. I wish that your stay here will be filled with warm experiences and hope that you find some time to explore and enjoy our beautiful island. I encourage the St. Lucia technical team and stakeholders to provide you with their full support and cooperation during the implementation of the various project activities. I pause now to thank especially His Excellency Ambassador Luis Lopez Moreno and his team for their continuous support and intervention on behalf of the government and people of St. Lucia. Ambassador, without the commitment of yourself and your team, we may have not realized such significant results from the cooperation between the government of St. Lucia and the government of Mexico. Once again, I salute your efforts. I thank you for your commitment and your passionate efforts to secure this support for the government and people of St. Lucia. We will be forever indebted to you for your understanding. I also thank the staff of the St. Jude Hospital Reconstruction Project Management Unit, who have worked assiduously with our partners towards the realization of this grant. I assure all that the government of St. Lucia is firmly committed to completion of this new facility and resolving expeditiously any difficulties that may arise during the course of execution. I thank you and wish all of you a very, very pleasant day. Thank you and good morning.